We spoke to some GPs this morning.
Good morning.
They feel like they're in a bit of a difficult position because the medical advice is to avoid AstraZeneca. The preferred option is Pfizer for those under 50. In what circumstances do you think doctors are going to go against that medical advice?
Well, I certainly won't preempt the decisions of individual doctors. I will say that what we've received is medical advice that the AstraZeneca is safe and effective for the over 50 Australians, and that, of course, is over 8 million Australians, and where the program is focused now, exactly as you said, and that continues. And indeed, we are likely to have had a very significant number once we have the final figures in of vaccinations yesterday, and we're well over 1 million now. For the under 50s, the medical advice is it's not preferred. There is the option for those that wish to pursue it to discuss with their doctors. But as with many, many different medicines or vaccines, those decisions are available for patients and doctors to consult, and it's not for us to intervene, but it is absolutely our duty to make the medical advice available at the earliest possible time, and secondly, to ensure that as a government, we follow that medical advice. And so for now, the vast bulk of the program does remain unchanged, other than for those who are under 50 in the health workers and the immunocompromised groups. But for the over 70s and the over 80s, who are the centre of the phase 1B, for the over 50s and over 60s, who will be the centre of the next phase, phase 2, that remains unchanged. For the over 55 Indigenous Australians who are part of phase 1B, that remains unchanged.
So,
so that continues exactly as you said.
Yeah, so all that said, this should not delay the rollout.
Well, it will have an impact on the timing for now of some of those under 50, but we've had very significant vaccinations going on. We've passed that million. We've quadrupled the number of vaccinations in the last 2.5 weeks as we've moved to the general practice phase of the rollout. And I'm incredibly pleased that we are using general practice as the backbone, but with the support of the states, and also I think it's very important that we did exactly what we said we would do and have the full and thorough safety assessments which have underpinned this process. And so the medical advice has put Australia in a position which is very different to the vast bulk of the world. 0 cases on 58 days or during the course of the year, more than half the days. 500,000 cases a day on average around the world over the course of this year, and over 10,000 lives lost. And so we are in a very different place to the world because of that medical advice. And although it was a difficult decision, we didn't hesitate to make it and take it, as we did with closing the borders with China or with the University of Queensland molecular clamp, and not continuing that. So that's our responsibility, but our strength as a nation is we have deep, profound reserves of vaccines, and we have a fundamental faith and commitment to the medical advice and keeping Australians safe.
Well, let's look at 1A. 674,000 people fall under this category. How many of those have been vaccinated?
So at this stage, what we see is that we have had over 125,000 people that have been vaccinated through the aged care rollout within the 1A. The states will put out their figures through the National Cabinet over the course of the coming day or days.
Minister, sorry to interrupt, but aged care is only a small subset of that 1A category. It also includes frontline workers, health workers, aged care staff, and also the National Disability Insurance Scheme, and those working in the disabled space. So can you tell us how many of those 674,000 of the most vulnerable and frontline workers have actually been vaccinated?
The figures from the states are being calculated today, so I respectfully don't want to preempt,
but we're 7 weeks in.
Their announcements.
Is it half or is it 3/4? Do you have any kind of idea at all?
No, the states have overwhelmingly completed their frontline health workers and overwhelmingly completed their quarantine and border workers, and so what we're seeing is very significant progress. And what I can say is that In particular, we've been able to now reach over 1 million vaccinations, and we've seen the general practice vaccinations on yesterday's figures. We don't have today's yet. General practice vaccinations pass over 375,000, which are primarily focused on the over 70s and the over 80s.
Yep.
And that has allowed us to multiply it, and that will continue. So we're working through all of those phases with the vast bulk of those unchanged, but for the under 50s, where necessary, then we will reprofile them to have access to the Pfizer.
Okay, so we've only got 1 million Pfizer vaccines that have been delivered so far. Is that correct? So how many do we have and how many have we used?
So 872,000 Pfizer vaccines have been delivered, and some of those have just been cleared. The next thing is that we have used approximately 622,000 AstraZeneca vaccines. So the balance of those are Pfizer, and some are with the states. Some are being delivered to aged care today, and so we will continue to receive what we have seen so far, very consistent, very reliable imports of Pfizer. It is due to step up in number during the course of April, due to step up again in May on our advice from the Australian head of Pfizer, Anne Harris, only yesterday, and then due to step up in July. And over the course of the year, the advice only yesterday was that the full 20 million is expected during the course of this year. And
how many more will we need to order from
all
Pfizer?
Australians. Well, we'll take advice, and we respectfully, and I hope you understand this, don't preempt any of our international commercial negotiations because it's highly competitive, the international environment, and we always provide advice to the public as soon as we have achieved something such as that.
But we've already done a deal with Pfizer. Is it as simple as asking them for more?
Well, I'll respectfully not go into the details of what we may do, but when the University of Queensland molecular clamp didn't proceed, we were able to exercise an option in the contract and double those doses from 10 to 20 million.
Yep.
And we'll continue to follow the advice of the Scientific and Technical Advisory Group. They're the Vaccines Purchasing Advisory Group, and we work quickly and we work swiftly on their advice. We've followed it scrupulously, which has allowed us to purchase 150 million vaccines, and where they provide advice, we do that. I certainly won't rule out additional purchases, but I respectfully, for reasons of intense global competition, won't preempt
intense global competition,
either volumes or particular supplies.
We thought we were at the front of the queue. Is the intense global competition why it appears we are not? No, well, we've done two things. One is we wanted to make sure that we had a full and thorough safety assessment, and I could not be more reaffirmed in that decision. There were some in December and January who said, jab now and don't worry about that full and thorough assessment. I think that decision has been utterly reaffirmed by recent events. And of course, this is a global challenge right across Europe, across the UK, and then many other countries such as Japan and Korea and India will be facing similar decisions to that which Australia has faced, and they'll all make their own decisions. But having made that medical advice, or followed that medical advice and made those decisions, the adaptation now is to ensure that we have a consistent pathway for the under 50s, but for the over 70s now, and then the over 50s in the next phase, that program remains unchanged. And then for the under 50s, we've still got significant Pfizer reserves, 20 million over the course of the year. But if more is recommended by the Scientific and Technical Advisory Group, more will be procured, and I would say stay tuned.